Good morning everyone. My name is Anudeep Nallamothu and today I will be presenting my research on identifying lung cancer risk factors among urban Indian women. This analysis was conducted using Tableau and focuses on environmental and genetic and socioeconomic factors that contribute to lung cancer risks and outcomes in this specific demographic. And coming to the introduction, our primary research question is what are the risk factors contributing to lung cancer among urban Indian women? And we explored three sub-questions. How does that average at diagnosis impact the outcome? And the second one, what are the main causes driving stage 3 lung cancer? The third, which mutations are most prevalent in this demographic? The aim is to support healthcare professionals, policymakers, and public health advocates in shaping targeted policies to improve early detection and survival rates. And coming to the first chart, that is pie chart, and the pie chart shows mortality risk across different stages of lung cancer and for urban and Indian women. The data was filtered to include only female and urban Indian patients which are confirmed with lung cancer diagnosis. Key findings, like stage 3 has highest mortality risk, significantly more than stage 1. And coming to the this suggests that many cases are being detected late, likely due to delayed screening and or diagnostic influences inefficiencies, and also we also used to supplementary visualization to access the environmental and social factors such as air pollution and second-hand smoke exposure and socioeconomic status, all of which impact 5-year survival rate. And coming to the findings, this finding indicates stage 3 diagnosis is the deadliest and pointing to urgent need to be improved early detection systems. Interestingly, stage 4 shows relatively lower risk, which may be due to the survival biases. Socioeconomic factors and poor access to health care further worsen outcomes. Together, this point to systematic gaps that demands attention and policy reform. And coming to the second question, the second sub question illustrates the chart is about the bar graph. Here we see the bar chart analyzing risks, the six major risk factors for urban Indian women diagnosed with stage 3, which we have taken family history, indoor smoke exposure, mutation type, occupational exposure, smoking status, socioeconomic status, and the mutation type and the highest distant count, followed by smoking status and socioeconomic status. And coming to the key findings, this suggests that genetic mutations are major risk driver, and especially at stage 3. Lifestyle factors such as smoking and socioeconomic challenges also plays a crucial role, and environmental exposures ranked lowest but still remains relevant contributors. And also this shows that lung cancer risk is multifractional and requiring strategies that address both biology and behavior. And there are different kind of diagnosis and the mutation types, which you can see in the graph, like the family history. It shows all six kind of things. um, and this chart shows the lung cancer risk, which is multifractional. So coming to the third chart, the next one, the chart we analyzed is like a mutation specific mortality risk for patients at stage 3, which visualization we focused on ALK in four categories, which is ALK, EGFR, KRAS, and no mutation. EGFR mutation showed the highest mortality risk, followed by the patients with no detectable mutations, and ALK and KRAS mutations were associated with lower risk. And coming to the findings, the points We took like India and female, and also the country India we took, and the gender female, and the rural urban we took for this also. The highest risk in patients without detected mutations suggest other systematic or environmental factor maybe maybe at play, such as a poor healthcare access or misdiagnosis. Like personalized treatment and better mutation screenings are essential for improving survival. And coming to the recommendations, we created the dashboard which shows like three graphs. One is pie chart, and one is a chart, and one is a bar graph. In that also we created a storyboard chart with lung cancer prediction, which is mortality risk among urban and the factors contributing, and what are the mutation types. We have created all the graphs like this. And coming to the recommendations based on the analysis, I recommend the following is to implement widespread genetic testing to detect EGFR and KRS mutations early, and also strengthen the early detection programs, especially targeting stage 1 and 2. And also the third one, increase health education on smoking and second hand smoke and occupational risks. The fourth one is like improve healthcare access for lower income urban women. And the fifth one, like the tackle air pollution, especially in urban areas. These inventions should be integrated through partnerships between healthcare providers, public health agencies, and also the community leaders. And coming to the conclusion, to conclude, urban Indian woman diagnosis with lung cancer at stage 3 faces highest mortality, and EGFR mutations and socioeconomic barriers are the key contributors. And also lifestyle and environmental exposures further compound the issue. Lung cancer is in this group driven by the biological and behavioral and also systematic factors. Addressing this requires a multifaceted approach involving like early diagnosis, and also helps for do some public awareness which helps, and also healthcare reforms, and also environmental policy. These are the conclusion, like for the chats we can conclude like we have to approach the public in many different ways to create the awareness. And thank you for your time.